people just do double, triple looks. And I know that they're looking at me, you know, but you just try and just not put any kind of attention to it, or maybe you just turn in a way that maybe they can engage you for conversation and answer a question.
Not just her experience, it's the experience of many people who have an autoimmune disease called vitiligo. It's a disease that's hard to hide because it attacks the surface of the skin.
But this morning, our in-depth reporter Anthony Hill talks with a doctor about what you should do if you notice the early onset of vitiligo and what treatments are available.
Vitiligo is an autoimmune disease that attacks pigmentation, causing people to lose their natural skin tone. Doctors still don't know exactly what causes this autoimmune disease, but here is what we do know. Vitiligo is not life-threatening, it's not contagious, and it affects about 1% of the world's population, regardless of race or gender, but tends to be more prevalent among older people. I wanted to find out more about this disease and what's being done to find a cure, so I went to the office of Dr. Seth Foreman. Hello. He runs a dermatology practice in Tampa and is an expert in treating vitiligo. Dr. Foreman told me vitiligo can be reversible, but chances of that happening are best if it's treated within the first 2 years of onset.
I have a lot of confidence that we can recapture the pigment, both with topical medications as well as phototherapy.
Phototherapy is done in what looks like a tanning booth, but there are big differences in the way they are used.
So this is the narrowband ultraviolet B phototherapy unit. This provides phototherapy that have generalized vitiligo as well as some other skin conditions such as psoriasis or eczema. But for these purposes, patients with significant vitiligo get into the booth, that we close the booth, and then we turn on the lights. And this light therapy is what's supposed to help repigment the skin by sort of scaring away the white blood cells that are attacking the pigmented cells on the top layer of the skin.
Coming up on ABC Action News this evening, we're going in depth on the realities of living with this autoimmune disease. My conversation with a local woman who noticed a white spot on the back of her neck when she was just 16 years old.
It was alarming because I'm, just darker skin, so it was something very different. And we went to the dermatologist and they confirmed at that time that I had vitiligo.
Plus, a local group that's making it easier for people living with vitiligo to come together and support each other.
And it was founded because there were no support groups here in the state of Florida when I was diagnosed in 2014 with vitiligo.
In Tampa, I'm in-depth reporter Anthony Hill, ABC Action News.